Afternoon, everyone. Thank you so much for joining us for this webinar, Preventing ACEs in Ohio, Building Skills and Strengthening Connections to Caring Adults. My name is Haley Aka. I'm the Vice President of Operations and Strategy at HPIO, and we're so glad to be with you all this afternoon. HPIO is an independent and nonpartisan organization. Our mission is to advance evidence-informed policies that improve health, achieve equity, and lead to sustainable healthcare spending in Ohio. I want to take just a minute to thank our core funders who advance our mission with their steadfast investment in our work. A special thank you to the Harmony Project, the Ohio Children's Hospital Association, and the Brooding Foundation for contributing to Ohio's work on adverse childhood experiences. I also want to thank our 2023 Educational Event Series sponsors for their generous support of these events. This will be a short, sweet webinar today with only one fabulous speaker who I'll introduce to you in a minute. So as our speaker is presenting, please feel free to type any questions you have in the chat or the question box. We'll address a few of them at the end of the webinar as time permits, but we'll also be able to get back to you with questions after today if you submit them either through the chat or the Q&A. We'll also have some poll questions at the tail end of our webinar today, so please stick around for those. Today's presentation slides and other related resources will be available on the HPIO website. You can find those at hpio.net, and by clicking on the Events tab, you'll see everything from today. Now I'm really happy to introduce to you Becky Carroll, who's the Director of Policy Research and Analysis at HPIO. She's also the lead author of this publication and of our ACEs strategy work. So Becky is going to walk us through HPIO's latest research on the implementation of strategies to prevent adverse childhood experiences. And with that, I'll pass it to Becky.
Thanks, Haley. Good afternoon, everyone. Thank you so much for joining us for the webinar today. Again, as Haley mentioned, my name is Becky Carroll. I am the Director of Policy Research and Analysis at the Health Policy Institute of Ohio. With that, I will jump in. I'm going to make sure my slides are going to click. There we go. Okay. Adverse childhood experiences, or ACEs, are potentially traumatic events that occur during childhood. Exposure to ACEs is a pervasive problem affecting many children in Ohio and across the country. Research literature generally groups ACEs into these three categories: abuse, household challenges, and neglect. National data and analysis provide clear evidence that ACEs exposure is linked to poorer health and well-being through adulthood, including challenges related to disrupted neurodevelopment, social and emotional challenges, disease, disability, and premature death. In addition, ACEs exposure has severe long-term cost implications at the individual and societal levels. In 2020, HPIO launched the Ohio ACEs Impact Project and released a series of policy briefs on the health and economic effects of ACEs in Ohio. But we also wanted to identify things that could be done to prevent ACEs. We were very optimistic when, in our initial review, we found more than 180 strategies that had evidence of preventing one or more ACEs or mitigating the negative effects of ACEs. We see this as being a glass half full because we know that improvement is possible. We chose to elevate 12 of these evidence-informed strategies, which meet the three criteria shown in these circles. First, they are all primary prevention strategies, meaning that the intervention comes before ACEs occur, as opposed to screening or clinical treatment that would happen after the fact. All of these strategies also have a positive cost-benefit cost benefit ratio, meaning that the total social benefits of the strategy outweigh the total costs. And finally, these strategies have evidence of affecting the ACEs with the most significant health impacts in Ohio. In our previous work, we found these ACEs to be emotional abuse, sexual abuse, and living in a household with someone who has a substance use disorder, mental health condition, or who is incarcerated. HPIO is now working on a new ACEs policy brief series in which we take a closer look at each of these 12 evidence-informed strategies, analyze the extent to which they are currently being used across the state, and make recommendations of how implementation could be enhanced or expanded. We also include best practices and challenges to help organizations wanting to implement the strategies. Last month, we released the second brief in that series, and that brief is the focus of our webinar today. The first brief in the series analyzed these 4 strategies: early childhood education programs, early childhood home visiting, medical legal partnerships, and family income supports, in which we highlighted the earned income tax credit. We hosted a webinar on this first brief back in December, in which we had several speakers from around Ohio talk about their experiences with implementing several of these strategies. This quote from Dr. Khan at Cincinnati Children's Hospital Medical Center really stood out to me. He was talking about the considerable reductions in hospitalizations they had seen among families who had been referred to their medical legal partnership. He said, if there was a pill in medicine that led to a 38% reduction across all outcomes, you can imagine every pharmaceutical company would be going after it, and every insurer would be willing to pay for it. This was a great webinar. You can access the recording on our events page of our website, so please go take a listen to it. Now we'll move on to, oh, sorry about that. There we go. Now we'll move on to the strategies highlighted in that most recent policy brief, in which we examine key strategies to enhance skills so that parents, caregivers, and youth can handle stress, manage emotions, and tackle everyday challenges, and also strategies to connect youth to caring adults and activities. These strategies build on what are called protective factors, which are assets and resources that can buffer children and families from the harmful effects of toxic stress and adversity, and promote the ability to withstand, adapt, and recover from trauma. Increasing these protective factors can lead to stronger families, better health, educational, and employment outcomes, and benefits to society at large. We'll start with strategies to enhance these important skills. Nurturing and responsive caregivers and a safe, stable family environment in which basic needs are met and boundaries exist give children a strong foundation. These are powerful protective factors that can decrease substance use, mental health problems, and behaviors that increase the risk of poor health outcomes in adolescence and later in life. Also, research has shown that having at least one nurturing, stable caregiver can mitigate negative effects of ACEs. As shown in this graphic, 88% of Ohio adults reported that during childhood, they had an adult in their household that made them feel safe and protected all or most of the time. However, I know from experience that parenting is a very challenging job and one that generally comes without training. The stressors and adversities experienced by some parents and caregivers, especially those living in poverty, can undermine their ability to provide that secure, healthy, and nurturing family environment. And this really requires broader system changes and supports to lessen these barriers. But in the brief, we highlight parent, caregiver, and family skills training programs. These programs have been shown to strengthen family relationships and support parents and caregivers by increasing understanding of child development and positive behavioral management strategies. Programs are generally designed for families with children within a specific age range. Although programs vary in how they're delivered, this slide shows examples of common content areas. So some examples are healthy communication strategies, problem-solving skills, and safe and effective discipline. There is strong evidence that group-based programs improve child behavior and parenting. They can also reduce stress, depression, and anxiety for parents and caregivers and increase feelings of self-efficacy. There are many of these evidence-based programs operating throughout Ohio. One that we highlight in the brief is Triple P, or the Positive Parenting Program. Triple P is actually a system of programs for parents and caregivers. There are 5 levels of intensity based on family need, ranging from the level 1 light touch to a more highly targeted program for families dealing with complex family and mental health issues, which this is known as level 5. There are also specialized course offerings for different age groups, needs, and circumstances, and there are flexible setting options, including one-on-one delivery, small groups, large public seminars, and a self-paced online course. In May of 2022, the online Triple P and Teen Triple P programs became available free of charge to all Ohio families, granting them access for 1 year upon enrollment. This was offered through a partnership between the Governor's Children's Initiative, the Ohio Children's Trust Fund, and the Ohio Department of Job and Family Services. As of June of this year, more than 10,000 Ohio parents and caregivers had enrolled in one of these program offerings. And the map on this slide gives you a sense of enrollment by county. Here are a few of the best practices and challenges that we call out in the brief. One best practice is to choose the most appropriate program for the audience. For example, one-on-one programs have been shown to be more effective for families at high risk for conflict and child behavior problems. Secondly, many of the evidence-based programs have been modified for families of various races and ethnicities. Research shows that tailoring program materials for the families participating can considerably improve engagement and can actually increase retention rates by up to 40%. In terms of challenges, we heard about workforce shortages, which are keeping many programs from meeting demand. We heard about barriers to participation, such as transportation and childcare. And we also heard that evidence-based programs can be costly. We actually heard that Triple P is one of the more expensive options. For each strategy, the brief includes strengths, gaps, and recommendations. I'm not going to spend a lot of time on these, but encourage you to go take a closer look at them in the brief. Here we recommend increasing awareness, enhancing funding for other evidence-based programs in addition to Triple P, and including these programs in graduate school curricula for professionals who will interact with children and families. Our next strategy is school-based violence, bullying, and intimate partner violence prevention programs. On this slide, there is data on the percentage of Ohio high school students who have experienced violence and bullying broken out by sex. And the rate for Ohio overall is also shown by the red lines. Males are much more likely to be engaged in a physical fight, while females are much more likely to experience sexual dating violence and be bullied via texting or social media. So there's some large disparities here. Again, the next strategy is school-based programs to prevent peer violence, bullying, and intimate partner violence. These programs seek to reduce bullying and victimization before they start by building self-awareness, emotional self-control, self-esteem, conflict resolution, and other social skills. They can be implemented solely in a classroom setting or extended to include interactive and community components as well. This picture and the earlier one are from a teen violence prevention and healthy relationships program in Warren County. There are several Ohio laws in effect that encourage violence and bullying prevention in schools. Here are a few examples, and there are also others in the brief. First, school districts are required to report on the types of prevention-focused programs, services, and supports that they provide. They must also establish an anti-harassment, intimidation, and bullying policy. And they're required to provide some developmentally appropriate instruction in violence prevention and dating and sexual violence prevention in older grades. So we don't know the full extent to which schools are implementing evidence-based violence prevention education programs, but we do know that there are these requirements in place. In the brief, we describe two evidence-informed in-school dating violence prevention programs. One is called Dating Matters, and the other is called Safe Dates. We highlight our interview with New Directions of Knox County, who is collaborating with school districts in their county to implement a school-based program based on Safe Dates. Safe Dates seeks to improve conflict resolution skills and encourage help-seeking and help-giving behavior while changing adolescent norms on dating violence. In terms of best practices, we had multiple key informants stress the importance of having community prevention components to complement the school-based curriculum, so having a more comprehensive approach. Our other best practices include engaging youth in program planning and ensuring content is developmentally appropriate and trauma-informed. The challenges we have listed here are especially relevant for dating violence prevention programs, but also are applicable to other violence prevention programs. First, while fidelity to evidence-based models is important, our key informants really emphasized the need to tailor these evidence-based programs for the community and to align with the policies and the values of the school. We heard that the rigid frameworks of the evidence-based curricula can often be a challenge for schools when they're trying to make the program applicable, engaging, and personal to students. And secondly, parental and community buy-in can also be a challenge, given that school-based dating violence prevention programs cover sensitive topics, including sexual activity. Key informants recommended notifying parents, caregivers, and teachers of expectations prior to the program's start and providing a choice to opt their child out. Here are the strengths, gaps, and recommendations. One gap we mention here is that Ohio is the only state that does not have comprehensive health education standards. Instead, the General Assembly has simply mandated a list of topics that must be addressed in schools. So one of the recommendations here is for Ohio to adopt comprehensive health education standards to strengthen schools' ability to really fully and effectively implement prevention programming. The next strategy is school-based social and emotional instruction which is also commonly known as social emotional learning. It teaches and enhances critical life skills that children need to handle stressful situations, manage emotions, and tackle life's challenges. This picture shows some students from an elementary school in Cleveland, and this is from an article on this very topic. At its core, social emotional learning results in the ability to successfully interact with others, form and maintain positive relationships, set and achieve goals, make responsible decisions, feel and express empathy toward others, and understand and manage one's emotions. Research shows that children with strong social and emotional skills end up being more successful in education and employment and experience greater lifetime well-being. These skills also lessen the likelihood of mental health challenges and risky behaviors such as substance use. Ohio law does not require social emotional learning in kindergarten through 12th grade education. Ohio does have social and emotional learning standards, but schools are not required to use them. Ohio does have early learning and development standards, which include social emotional learning competencies for children from birth to kindergarten entry. I also wanted to mention the Student Wellness and Success Funds, which are distributed using the school funding formula. These funds can be used for a variety of wellness activities, including for social and emotional learning. We don't have a complete sense of how many districts are using social emotional learning, but we do know that in the 2020 to 2021 school year, more than 81% of Ohio schools offered prevention-focused curricula, and Second Step was among the top 5 used by schools. Second Step happens to be the program that we highlight in the brief. It is an evidence-based social skills program. In the brief, we highlight our interview with Fairfield Union Local School District in Fairfield County and Ohio Guidestone. Fairfield Union contracts with Ohio Guidestone to come in and deliver the Second Step program to select students in kindergarten through 4th grade. Social emotional learning can be integrated into daily classroom instruction, and/or schools can provide a specific program, such as Second Step, to students outside of normal class time. For example, Ohio Guidestone worked with students during lunchtime. A couple best practices are to begin at early ages and to tailor social emotional learning programs to the needs of the school. Schools can use data to assess needs and tailor their programs as necessary. For some schools, a best practice might be to contract with an experienced prevention education provider like Ohio Guidestone in this example. This frees up capacity for teachers and school staff. In terms of challenges, we heard about workforce difficulties. Apparently, there is considerable turnover due to low wages among prevention educators. Funding can also be a challenge given all the competing priorities of schools. And of course, there's only so much time during the school day. 2 recommendations we make are to encourage and support schools in adopting the social emotional learning standards, such as through targeted funding and training. And secondly, to encourage teacher and early childhood training programs to include social emotional learning coursework and provide professional development opportunities to teachers who are already in the field. Next, we'll move to connecting youth to caring adults. Non-family relationships, such as those formed through mentoring and after-school programs, and social support are community-level protective factors which protect against depression and anxiety and buffer against adversity. Connecting youth to caring adults and activities can lead them to be more engaged in school, establish positive networks and experiences, and set healthy life goals. Mentoring and after-school programs can reduce the prevalence of crime, violence, and other adolescent risk behaviors and lead to positive outcomes in adulthood. In mentoring programs, youth are matched with a volunteer from the community with the goal of fostering a relationship that will contribute to the young person's growth and future success. Mentoring programs are generally more effective for youth perceived to be at risk for academic, behavioral, or health problems. Mentoring programs can also buffer against negative factors in a youth's life and play an important role in healthy development. Specifically for programs that aim to keep youth from becoming involved in the juvenile justice system, there is strong evidence that mentoring programs reduce delinquent behavior, aggression, and drug use. This picture is from a news story about Big Brothers Big Sisters Miami Valley, which is a mentoring program serving youth in Montgomery, Miami, Greene, and Preble counties. There are a wide variety of mentoring programs offered throughout Ohio. Some programs are centered around a specific purpose, such as academic enhancement. Others are geared toward a certain population, such as pregnant and parenting teens. Big Brothers Big Sisters of America is one of the most well-known national mentoring organizations. It has 5 affiliates in Ohio. We were lucky to have an interview with the Greater Cincinnati affiliate for this publication. And I actually learned through that interview that Cincinnati is where Big Brothers Big Sisters started in 1903. Research has found that positive outcomes from mentoring relationships are most likely to occur when a mentor-mentee relationship lasts for at least 1 year and when mentors engage mentees through shared activities, thus allowing the relationship to grow on its own. Successful mentor-mentee matching is also important. Programs should examine individual characteristics of mentors and mentees to initiate matches. And finally, effective mentor training and ongoing support for mentors is important. On the challenges side, funding, of course, there is no dedicated state funding for mentoring programs. Another challenge is recruitment of qualified caring adults. It's important for these programs to find adults who are willing to commit to the mentoring relationship. And then there are external risk factors. For example, factors such as ACEs exposure or lack of trust in adults can get in the way of youth benefiting from involvement in one of these programs. In these cases, it might be better to refer them to more appropriate services and try mentoring again in the future when they might be more open to the experience. Here we make a recommendation for state funding of mentoring programs and mention an example program from Massachusetts. I'd like to quickly point out that there is even more information in an appendix document, including additional best practices and challenges, which might be useful for organizations who are implementing these strategies or wanting to implement them. That appendix is linked within the brief and it's on the publication page. Also, we're currently working on the next policy brief in this ACEs series, in which we will cover these final 4 strategies. We expect to release that in early 2024. Thank you so much for attending today. I'd be happy to answer questions if we have time.
Unfortunately, I don't think that we do have time, but what I'll say is thank you so much, Becky, for all of the information, and thank you to you all for your thoughtfulness in the chat. As people were asking questions, others were answering them, including members of our team, and it was just a really lovely conversation over there. So thank you all for your time and attention today. Here's Becky's contact information. If you have additional questions after today, I'll speak for her. You're absolutely welcome to reach out and let Becky know thoughts that you have or questions that you have after today's conversation. Moving to the next slide, we really hope that this work is helpful for you in your efforts to influence policy and improve health and well-being in our state. There are lots of ways to do that, both as a private citizen and as a representative of your organization, including some of the things here on this list. With these things in mind, please take a second to answer a poll that we're going to throw. These really help us in our internal efforts to produce great webinars for you all and bring you the information that you need. And this includes a question about using this information to influence the policymaking process. We really appreciate you responding to that for us. I'll just give you a second. I'm seeing thank yous in the chat. Thank you to you all. Thank you so much for being here.
And you should see a total of 4 questions. So if you can get to all of those, we'd appreciate it. And then we'll let y'all go.
Yeah, feel free to scroll down, answer those 4 very quick questions. As you're doing that, I'll remind you that the slides for today's presentation and some related analyses are all up on our events page, hpio.net/events. There'll also be a recording up there within the next couple of days. And then I'll throw a slide so you know how you can connect with us in the future. We're in all the places you need us. Thank you so much. Thank you for being here. Enjoy the rest of your day. Bye, y'all.